Welcome to the webinar, Improve Residents' Communication Skills Prior to Arrival and Orientation. Hi, I'm Barbara Lewis. I'm the Managing Editor of .com, and joining me today is Surendra Marur from the Greater Baltimore Medical Center. Welcome, Dr. Marur. Tell us a little bit about your background.
So essentially I'm an internist by training, and right after residency my first job and only job has been in medicine, in medical education. And so I've been training internal medicine residents since 2002. I'm presently the Associate Program Director of the Internal Medicine Residency Program here at the Greater Baltimore Medical Center. And we've been trying many different innovative techniques to help improve our resident education.
And we're going to be talking about one of them today. Unfortunately, Dr. Simone couldn't join us today. The webinar is going to, but I'm going to actually talk about his program. So I have interviewed him and I know about it and I will be talking about it. The webinar is going to last about 30 minutes and the recording and the PowerPoint will be available on the .com website shortly. If you do have questions, you can type them in the chat box, which is located on the panel. And if we don't get a chance to respond to your questions during the webinar, we certainly will answer them afterwards. There might be a slight lag time when viewing the slide, but first of all, I thought I'd just show you or give you a little bit about my background. I have a rather unusual background and have had a very circuitous route to the managing partner, or the managing editor, I should say, of .com. I began my career as a journalist. I wrote for the Wall Street Journal and more recently for the British Medical Journal and Modern Healthcare. Then Act 2 of my career, I segued into marketing. I founded a marketing consulting company and went back to school to get an MBA from UCLA Anderson School of Management, where I've taught business communication. For 7 years, I served as Orthopedic Hospital's IRB as their lay representative. But my life was turned upside down several years ago when I spent 2 weeks in the ICU with my sister Joan, who had been admitted with an unknown infection. And wearing my marketing hat, I logged the good, the bad, and the ugly about her care. And unfortunately, she passed away quite tragically. I wrote a document called Joan's Family Bill of Rights about her care, and I sent it to the head of the ICU. She passed it along to the hospital CEO, and then he sent it to the heads of the health system. And they flew me across the country to speak at 3 of their facilities, which they videotaped and called it, quote, the cornerstone of their training program. And I was very honored to give my sister a voice, and I had completely expected to return to my marketing consulting company. But I was so shocked at the number of people who were lined up after every presentation to tell me their stories. And I realized that I wasn't just relating my personal story, but it was really a universal narrative. So at that point, I decided to devote the rest of my life to improving the patient experience as Act 3. And I received a grant to research what medical schools were teaching around the patient experience. So I contacted the U.S. schools and heard back from about 30 on innovative courses. And I happened to come across .com, an online communication learning system that was founded in 2005 by the American Academy on Communication in Healthcare and Drexel University College of Medicine. And I was so excited about the curriculum because I realized that the core of many of the issues that I had faced in the ICU with my sister was, in fact, communication. So at the end of the interview, something happened that had never occurred in my journalism career before, and that was that the 2 physicians began asking me questions. And when the conversation ended, they asked if I'd like to submit my resume as the managing editor of .com, a part-time position that I've held now for nearly 2 years. So I'm thrilled to be here, and thank you for everything that you do, Dr. Marur, and all of our listeners on the webinar today. I really appreciate everything that you do to help the patient. So let me, before we begin, talk a little bit about .com. So when Dr. Marur gets to describing how he's using .com, you're familiar with it. So as I mentioned, we started in 2003. We obtained a grant from the Arthur Vining Davis Foundation. We launched as a pilot in 2005, and we debuted as a nonprofit in 2006. And last year we were very fortunate that we received the capability to offer continuing medical education. So currently we have about more than 75 institutions. We're located in 9 countries, and we've been translated into 3 languages, with Spanish on the way very shortly. Originally, .com started focused on medical schools, and actually it was a result of the Kalamazoo Consensus, if you're familiar with that, where they came away and said we really need some communication training for our medical school students, and that's where it started. But our fastest growing area right now is residency programs, and I believe that probably our residency programs are going to surpass our medical schools this year. We've had 6 journal articles been written up that support .com and highlight the benefits of .com. So there's been a lot of evidence-based information and research done on the importance of communication skills. And one of the evidence-based research is that, or several actually, quite a few, have said that great communication skills improve medical outcomes. Good communication skills enhance physician and provider satisfaction. They decrease malpractice claims and improve patient satisfaction, and that's the HCAHPS surveys that are mandated by the government if the hospital receives funds from the government. So I just returned from ACGME, and I was really quite shocked in the survey that I did of the attendees that only 25% of them knew about HCAHPS and the importance of communication. There are 2 dimensions on the HCAHPS surveys that deal with communication. So we have leading faculty that are module authors. We have 42 interactive online modules, 400 videos, including annotated videos, literature references, and checklists. And the modules are divided into 5 sections: basic, just on mindfulness and self-care, essential elements that cover taking the history and developing the relationship, advanced elements such as shared decision-making, specific situations such as delivering bad news, and then dealing with colleagues. So all the modules have a very consistent format. There's the rationale, which you can see in the tree over here to the left. Then patient clinician views, reflection questions, learning goals, key principles, contents, and reference list. So first the patient starts by telling why she is coming to the exam and what her issues are that she hopes to have addressed. And then the doctor tells his view, what he hopes to accomplish during the exam. We have a behavioral checklist at the end, which is a synopsis of things to keep in mind as you're dealing with a particular communication challenge. Over 400 videos embedded. And for example, this is one of our many annotated videos which we have. So as the physician and the patient are discussing, the conversation is highlighted, and then if the user clicks on the little icon, out pops the clinician or the patient talking about, in this case, why he is discussing this particular area and what's going on in the back of his mind. We have this very interesting video that was added to our Module 6 last year, and this is to identify areas of missed opportunity for an empathic comment. So the clinician and the patient are talking, and the patient says things that could have an empathic comment, and the user clicks on various areas, and then when the audio and the video end over here, the user can see what time frame appropriate comments could have been made that were empathic. And I've taken this several times, and each time I get more empathic or empathetic. So we have lots of resources, facilitator guides, and syllabi to help faculty in case that's the way that you might be using .com. Okay, so now let me start talking to Dr. Maror and a little bit about his program. So can you describe your program, please?
Certainly. We're what we consider a mid-sized program located in a community hospital in northern Baltimore. We have 36 categorical residents with 8 prelim residents. And we have 9 full-time faculty with numerous subspecialists to help us with our training.
Mm-hmm. And of the residents that you have, do many of them have English as a second language?
Correct. I would say 80% of our residents have English as a second language.
Mm-hmm. So what was the problem that you were facing that you decided to use .com, or what challenges were you facing?
So as part of our orientation, so even before our residents start working, we put them through an orientation period, and the focus of the orientation is to teach, assess, and if we have to, remediate 5 basic skills before we let them start taking care of patients, because we're very patient safety oriented, and so we want to ensure that they have these 5 basic skills to minimize any patient safety events while they take care of patients. These 5 skills are history and physical skill, medication reconciliation skills, using our EMR, putting in physician orders, and then lastly what we call transitions of care. And so as you can imagine, the transitions of care and the history and physical require great communication skills. So as we had implemented this format for our orientation, we have direct observations as our method of assessing their history and physical skills, for example. And we noticed that quite a few of our interns who came from abroad had difficulties in terms of communicating, and also we would survey the patients as they did this particular assessment, and they would give us similar feedback. And so we wanted to intervene sooner if possible, because we wanted to have basically a fast growth curve before we let them start working. Our orientation period is only 7 days long, and so we wanted to maximize that time and get everybody up to speed on these 5 basic skills before we let them work.
Okay, so let me just stop you right there, because we did get a question, and one of it is, are there real patients or standardized patients? So in the .com module, these are standardized patients, and they're unscripted interviews, so nothing is scripted. They go in with the concept of what they're going to talk about. Now, in your case, Dr. Marur, the patients are real patients. Is that correct?
Absolutely. They're all active patients in the hospital.
Okay. So one of the things that you had told me about was that they knew the questions that they were going to ask the interns, the residents, but they didn't know how to ask the questions. Is that a fair statement?
Well, no, in the sense we would actually, give them an active patient in the hospital, and we would go through the whole format of chief complaint and history of present illness, etc. And it wasn't scripted in that sense. But we would, ahead of time, give them a format in terms of the level of detail we were expecting from every patient that they take care of. But despite even having that format, if you will, we were still seeing deficiencies. But we also recognize that, at least certainly in all of medicine, history is key to starting to take care of the patient, and it totally affects the hospital course. And so we think of it as basically data gathering. We want all of our physicians to have excellent data gathering skills, and then followed by data processing, and only then do we get good outcomes after that. So if we're not good data gatherers to begin with, we will not come up with good outcomes. And so that's why the emphasis on not only what questions to ask, but how to ask it and how to set the environment to maximize the quality of answers from your particular patient. And that's where doc.com came into play.
Right. So we used to be known as .com. We're now known actually as .com. We dropped the dot.
Okay.
So I would like you to just walk us through how you came to .com and why you decided that you needed to face this challenge with some resource.
Right. Well, so actually, my experience with .com came much earlier, before I came to Baltimore. When I was in Detroit, I actually was part of a team with representatives from .com, and we actually went to India to teach seminars on communication. And there was a team from .com at that time. This was back in 2006, 2007. So I was familiar with, the existence of .com at that time. But here in Baltimore, when we realized, the deficiencies that we had, we re-explored .com and how they not only emphasized, what to ask, but how to ask it and how to create the environment to get high-quality answers. And so it's really from the previous experience of .com that I had that brought me back to .com.
Oh, great. I didn't realize that .com had gone with you to India. That must have been fascinating.
Absolutely.
So what did you decide to do then?
So absolutely. So to basically speed the learning curve, we decided to start using .com actually at the point of match. So after match was decided, as part of our onboarding process, we would ask our new interns, to ensure that they have X number of basic skills even before orientation. And so we would actually, for example, ensure that they were good typists. And so we found an online typing tutor that could actually monitor, their typing skills, because that's very essential as part of the job today. In addition to that, we would assign certain .com modules right after the match, and they would basically do that from March till by the time they come to us in June. And because of .com's online learning nature, we were able to track which modules they were able to complete, which questions that they completed, and we were actually able to see ahead of time what the scores were for those particular modules, so that when they came to us in mid-June for orientation, we already knew who had deficiencies and what categories their communication deficiencies fell under. And so we were able to then create a learning program for them even at the beginning of orientation, because we had already identified the problems or the deficiencies, and that really sped the learning curve.
So they were using the multiple choice questions, and you were able to track that through that grading matrix that we have. It's actually color-coded, and it's quite interesting. You can see who scores what, green 100, and you can go down to the lower and lower it gets, the redder and redder it gets. So I love that, and I should have had this up here now so you could see everyone could see what it looks like. But I can send this off to everyone if you're interested. So what have you noticed since you started doing the assignment at the match in March? And of the 42, are you assigning, did you tell me you were assigning about 25 or something like that?
So we would assign it to the intern class, and so our categorical intern class is 12. And so we would be assigning it to 12 right after match.
And how many modules is that?
Oh, I'm sorry.
20,
I'm sorry. The number of modules. There were 20, correct. 20
modules. Okay. So 20 modules are assigned. So what was the difference that you saw between 2 years ago when you were making the assignment and orientation and last year when you made the assignment at the match in March?
So certainly when we did the direct observations for their history and physical skills, right away we noticed the skills that they were taught in .com. They were already displaying those skills of empathy and open-ended questions and things like that. And so we were very pleasantly surprised that the patient's experience, and certainly we, the assessing physician's experience, was very positive.
Mm-hmm. And now we have the match coming up, I believe, on March 18th again. And what are you going to be doing this year?
So the same thing will be, to get more objective data, we'll be doing pre-testing using questions from .com. So we'll do a pre-test of multiple choice questions. Then we will have them complete the modules, and then we'll do a post-test when they come to us in June to see if there was any change.
And that's to give you some quantitative data.
Exactly.
As to the change. Is that right? Yeah. Okay, great. Thank you very much. So if you have any questions, you can write them in the chat box. And I'm going to move on here to Mount Auburn Hospital and talk to you. Now, they're working this a little bit different. So what happens is when the residents come in, they perform a baseline communications, a mini CEX, and they identify 2 communication skills to target, such as build a relationship, which is one module, or open discussion, which is another module. And then they direct the residents to .com modules. And the 5, 6, 7, 8, 9, 10, 11, 12, and 13 are considered the core modules that we have that are the most closely aligned with the HCAP dimensions. So these are really very important modules, these 8 or 9 that we have about taking the history of the patient and building the relationship. So then the residents obtain permission from a real patient to videotape the encounter. So they've gone through the .com modules, they've hopefully practiced their communication skills on patients, and now they're going to videotape a patient encounter. And then the residents show their videos to the other residents for feedback. And then they view the video together with the faculty who provides feedback and really gives them a mini CEX. And Dr. Simone said to me that although the residents are nervous, the feedback is very positive about .com. So if you're interested in trying .com, I actually have a free trial subscription here for anyone on the webinar. But you go to .com.org and then click on subscriptions and click on group and then insert the number of users. So for example, it's about $45 per person. And somebody last week asked me, is that per month? No, that's per year. So for example, if you have 10 residents, the subscription price would be $450 for them for the year. So if you want to take a look at it, use this promo code, WebinarFeb16, and that will give you a free trial subscription. And if you'd like any other information from me, here's my contact information, my email, and my telephone number in case you want to call me. So let me just check to see if we have any other questions here. And I don't think we do. I think that was the only question that we had. So I wanted to thank everybody for attending. I really appreciate it. And Dr. Maurer, thank you so much for contributing to this webinar and talking to us about how you're using .com. And best of luck with your incoming residents.
Thank you. Thank you.
Thank you, everybody.